Here's something that might shock you. Right now, Tulare County residents struggling with severe mental health crises are being shipped out of their community, away from family and support systems, simply because local treatment options don't exist. But that's about to change in a big way. Tulare County has just received a massive financial windfall that's completely transforming their approach to mental health and addiction treatment. We're talking about a groundbreaking facility that could revolutionize how California's rural communities handle behavioral health crises. And this is the part most people miss. This isn't just another treatment center. It's the county's very first locked residential facility, designed to keep families together during their most vulnerable moments. The ambitious project is taking shape at 347 East Walnut Avenue in Visalia, where the old Casa Grande Senior Care Homes and Assisted Living Facility once stood. What started as an $11 million initiative has exploded into something much more comprehensive, thanks to additional funding streams that keep pouring in. This represents a complete game-changer for Tulare County, explains Donna Ortiz, the county's Health and Human Services Director. We're finally building the infrastructure needed to provide community-based services right here at home for individuals battling severe and persistent mental illness. No more forcing families to choose between proper care and staying close to home. But here's where it gets controversial, and frankly, there's absolutely no dedicated funding attached to Prop 36, meaning counties like Tulare are essentially expected to absorb these additional treatment needs without corresponding financial support. Dr. Cassie Ennis, the county's Deputy Director for Behavioral Health Services, doesn't mince words about the current situation. We're constantly sending people who need higher levels of care completely out of our county, she reveals. Imagine being in the midst of a mental health crisis and having to leave everything familiar behind, your family, your community, your entire support network. That's the reality we're changing. The transformation began when Tulare County secured its share of the massive $3.3 billion Proposition 1 funding, which California voters approved in March 2024, specifically to address the state's mental health emergency. The initial $11 million was just the beginning. Since then, the county has successfully captured an additional $9.9 million through the Behavioral Health Continuum Infrastructure Program, specifically earmarked for constructing, acquiring, and rehabilitating real estate assets that expand community-based behavioral health treatment options. And there's more money in the pipeline. The county also received $840,690 in opioid settlement funds, money that comes directly from pharmaceutical companies that have been held accountable for their role in overprescribing addictive medications. These dollars represent justice in action, Ennis explains. Companies that contributed to the opioid crisis are now funding the solution through treatment services and facilities for people struggling with substance use disorders. The additional funding has allowed county officials to dramatically expand their original vision. What was once planned as a single facility has evolved into a comprehensive campus featuring multiple specialized treatment environments. The first building will house a 60-bed augmented board and care facility, essentially an unlocked residential treatment center for individuals who need significant support with medication management, group therapy, and various services, but who have progressed further along their wellness and recovery journey. Think of it as a bridge between intensive inpatient care and independent living. The second phase gets even more ambitious. The county is planning 2 connected buildings that will serve distinctly different populations. One building will operate as a mental health rehabilitation center with 60 beds, while the adjoining structure will function as a substance use disorder residential treatment facility with 16 beds. This dual approach recognizes that mental health and addiction issues often intertwine, requiring specialized but coordinated treatment approaches. What makes this particularly noteworthy is that Tulare County is partnering with community-based organizations to actually operate these facilities, rather than trying to manage everything internally. This collaborative approach often leads to more innovative, responsive treatment programs that can adapt quickly to changing community needs. But let's address the elephant in the room, the Proposition 36 funding gap that could create serious financial strain on the new facility. Under this new law, certain offenders can opt for drug rehabilitation instead of serving jail time. While this represents a progressive shift toward treating addiction as a health issue rather than purely a criminal matter, it also means treatment facilities, like the one Tulare County is building, may find themselves serving additional populations without corresponding financial resources. The facility is absolutely intended to support individuals who might need services as a result of Prop 36 evaluations, Ennis acknowledges. However, it's crucial to understand that not every person affected by Prop 36 will necessarily need this intensive level of care. Treatment placement depends entirely on individual assessments and the specific severity of someone's substance use disorder or behavioral health conditions. This creates an interesting policy tension worth discussing. Should counties be expected to absorb the costs of progressive criminal justice reforms without dedicated state funding? Or does the broader social benefit of keeping people out of jail and in treatment justify the financial burden on local communities? The timeline for this transformative project is both ambitious and realistic. County officials are targeting November 2027 for the facility's grand opening, assuming construction proceeds without major delays. That's definitely our goal, Ennis confirms. We'll keep the community updated if anything changes. But our architect has already completed the bidding process and we're preparing to work with a selected contractor. There's even a thoughtful touch being planned for the facility's official name. Rather than settling for something generic, county officials are working through an internal approval process to name the center after a local behavioral health advocate, someone who has made meaningful contributions to the community's mental health landscape. The broader implications of this project extend far beyond Tulare County's borders. Rural and underserved communities across California are watching closely to see how this model works. If successful, it could provide a blueprint for other counties struggling to provide adequate mental health and addiction services without forcing residents to leave their communities. What do you think about this approach? Should counties be required to fund treatment programs for offenders who choose rehabilitation over jail time, even without dedicated state funding? And is keeping people close to their support systems during treatment worth a significant public investment? More importantly, does your community face similar challenges with mental health and addiction services? The conversation around local versus distant treatment options affects families everywhere, and it's worth examining whether we're doing enough to keep treatment accessible and community-based. Share your thoughts. Do you believe this comprehensive approach will actually make a difference? Or are we just creating another expensive facility that might not address the root causes of mental health and addiction crises in rural communities?